Hello, it's Phil Jacobus again, and today I'm joined by John Vano, who is the president of Radiology Oncology Systems. And John is one of the more thoughtful guys I know in the business. John, how are you?
Hi, Phil. Doing great, thank you. How are you?
I'm good. So John, are you in the office or working from home?
I am, Phil. I'm in the office. Most of our employees are working from home and have been, since March 13th when all this started. But fortunately for us, we've got two different suites. So I'm occupying one, and we have another employee that occupies the other one. So we've been able to keep social distancing nicely. But I can't. I can't not take advantage of the fact that there's virtually no traffic in Southern California. It would have been a sin not to take advantage of it. So I have been coming in here and taking advantage of it, and it was okay for us since we're considered, in the medical world, an essential business. So we were okay to, for some of us at least, to come in and out of the office. And then of course we've got the parts folks and things that do need to get shipped out. They're in here as the activities require as well.
I know that for those joining me today, ROS is in the oncology business, linear accelerators. And how has your delivery model for parts changed, or has it changed?
So it really hasn't, Phil. We still, machines still go down. Machines still have a need to replace parts. Now, the usage of machines, we believe, has declined a little bit, and we've seen that decline in our requests for parts and so forth. But because we service clients all over the world, we still are, shipping parts all over the world as needed.
You also sell machines. Is it more difficult, and how are you overcoming the challenges of selling a machine overseas during the COVID-19?
Sure. Well, the sales process is still pretty much the same. It's just the logistics that have been impacted. We still are getting requests, and there's still some, these machines take sometimes a month and often years to plan ahead. So a lot of the projects are still moving forward. But as you can imagine, some have been postponed. Hospitals shifted their focus from, capital projects to dealing with COVID. So obviously anything that wasn't critical was pushed behind. So we've had a few delays, but things are starting to sort of unclog now and move along. And the installations that were in the works and had already commenced continued. We still had very valiant engineers stepping in and doing the installations, wearing masks and protective gear. But we were able to actually complete several installations during this COVID phase. So yeah, things have been, progressing a little bit more slowly, but certainly still progressing.
Mm-hmm. Okay. Tell me, as I mentioned, you're sort of a philosopher, but you have a business degree. What do you think are the long-term economic, when you look into your crystal ball, what do you see the economy?
Well, I'll tell you, you'll hear a lot of people say this, but we are very optimistic, for the long term. We think this is going to pass. In the grand scheme of things, humanity has had pandemics really since the beginning of time. And even though it'll take probably a few years to recover from the economic fallout, I think we will bounce back and we'll be strong again. Now, the one thing that will impact us is the debt that we're accumulating now, whether it's government debt in dealing with this epidemic or pandemic, or whether it's individual debt as people take on debt to sort of sustain this period. So I think that will eventually be a drag on the economy. The money that's going to be used to pay down that debt or to pay interest on the debt is obviously going to drag down the economy. It's money that could be used elsewhere. We'll probably have to have a tax increase to service some of this, and that too will be a drain. But all in all, I think we will bounce back, and we'll get past it, and we'll be back to normal, and we'll reach a new equilibrium. there's an analogy of, you know, going to the hair salon, right? So hair salons have been shut down, you know, for the last few months, but when people go back, they really are only going to need one haircut, right? Even though salons have lost several haircuts. Same thing applies to restaurants and entertainment and so forth. So all that value that's permanently lost will, and the trickle down effect of that to the suppliers of those different businesses are going to have a long-term impact, no question. But I think we'll get over it, and I think we'll bounce back, and I think the economy will recover and will continue to grow as we were, you know, before the pandemic.
How do you think healthcare will change, healthcare delivery?
Sure. Yeah. It's a great question. You know, any big event has a lasting sort of impact on things. I mean, World War II brought along, you know, radar and all sorts of things, and no doubt this pandemic is going to alter healthcare, you know, for the future. I think in a lot of different ways. You know, I think our preparation for, you know, another pandemic will be obviously drastically improved. Whether it happens in a few years or in 500 years, I think we'll all know how to better prepare. You know, drug development. I mean, we've seen drug development now at a record pace that, you know, was sort of unheard of before this pandemic. But you have a number of companies that are racing to, you know, to develop, you know, drugs, and that I think will hopefully stick, so that in the future we'll reap the benefits of that. And then, as you know, a lot of patients now are doing things a lot more remotely. That was a trend that was already, you know, in existence, and now it's going to accelerate. And I think there's going to be heightened convenience for patients in the future. I think, you know, and hospitals are going to have to sort of, you know, take on this new technology at a more rapid pace and accommodate the needs of patients, or they'll lose their business. So that's really going to have an impact. And, you know, I have friends in the real estate business, and they're talking about how, you know, these trends are really going to negatively affect, you know, commercial real estate and healthcare real estate. Because patients now, for example, are not going to be wanting to sit around in a waiting room, right? And all that space is going to be wasted. But in reality, you know, hospitals and clinics are going to need more space, you know, between patients, right? So there's going to be some offset of that. You know, you might have more patients staying at home or doing remote types of procedures. But at the same time, when you're inside a hospital, you're gonna require more space. So I think there's going to be a little bit of an offset there. So yeah, I think you know, we'll be interested in observing, you know, the longer term impacts to the healthcare system and healthcare delivery. But yeah, I mean, a lot remains to be seen as well.
Well, John, you're a very insightful guy, and it's easy to see why ROS is doing so well. I appreciate you spending time with me today. And I look forward to seeing you in person sometime soon.
Thank you, Phil. And just a quick note to thank you, Phil, for what you've done for the industry and for .med. And I'll let you know that we personally benefited a great deal from having been partners with .med and allowing our brand and our message to be communicated throughout the world, and our products to be displayed around the world through your website and your various tools. So thank you in return.